I'm Juliana Fellows. I am the Community Prevention Manager at Prevention Action Alliance that oversees the Ohio College Initiative. And welcome to Training COVID-19 Contact Tracers to address college student mental health and substance-related risks. I want to give a big thank you to Ohio Mental Health and Addiction Services. They were able to provide funding for the Rise and Thrive webinar series. And the first four, this is the very first webinar in the series. The first four will be COVID-related topics, and then there will be additional webinars to come through September of 2022. And this, we are in partnership. Prevention Action Alliance is in partnership with Prevention First, HEC AOD, which is the Higher Education
Higher Education Center for Drug and Alcohol Misuse Prevention and Recovery.
Thank you. And then the campus, it is. And then Brittany, could you also read the Healthy Campus?
Yes, the Ohio Program for Campus Safety and Mental Health at NeoMed.
Yes, absolutely. So the funding did come from Ohio MAS, Ohio Mental Health and Addiction Services. That was generated from the governor's emergency education relief. So this, all the webinars will be free moving forward. I would like to introduce today's speakers. So we have Dr. Dolores Cimini, I hope I did that right, and Dr. Meredith Maroney. Both Dr. Cimini and Dr. Maroney are from the University at Albany, State University of New York. Did I say that right?
Yes.
Great. And a little bit about Dr. Cimini is she is a licensed psychologist and director of the University at Albany Center for Behavioral Health Promotion and Applied Research. She serves as a member of the American Psychological Association Commission on Accreditation and has co-edited 2 books on promoting behavioral health and reducing risk among college students, a comprehensive approach, as well as brief intervention and referral to treatment for substance use, a practitioner's guide. And then we have Dr. Maroney, and she serves as the health promotion specialist for the Center for Behavioral Health Promotion and Applied Research, and as a staff psychologist at Counseling and Psychological Services at the University at Albany. So welcome and thank you so much for your time and expertise on this topic.
Thank you. We're really excited to be here with you today. In terms of what we plan to cover, this is a training that we were asked to initially do for New York Department of Health. So we'll begin with an overview of the contact tracing process, more on COVID-19 and college students, but contact tracers need to know, communicating with college students related to the COVID-19 pandemic and health and public safety guidelines. And then finally, we'll close out with the role of isolation on mental health. Here are learning objectives for today. Describing the process of contact tracing and the role that it plays in either increasing the distress of college students or connecting them to resources, identifying mental health risks among college students and steps contact tracers may take to address these student concerns when working with them, and finally to identify resources that mental health professionals may share with contact tracers so that students can get connected to resources as needed. Okay, so to get started with the contact tracing process. So when a student or an individual, and again, we're speaking largely about college students, but this applies to everyone, is exposed to COVID-19, the first step is the rapid notification of exposure. And so if the individual has not already been made aware by the person they were exposed to, they will get a phone call from the Department of Health letting them know. that they were in close contact with someone. And the next step of that would be a contact interview. And so really getting a sense of what was going on for that person. And that could include giving instructions on getting tested or quarantining or isolating, depending on the exposure, and really assessing the needs of the individual who will be quarantining or isolating. The next step would be medical monitoring, so checking in with folks around that. And the final step is a contract closeout. So if an individual is kind of being mandated to quarantine or isolate, there is a date that they'll receive about when they can come out of that isolation. And so we'll share a little bit more about that as it goes along, but that tends to be the extent of the tracing process. In that interview, it'll be asking folks around other people they may have come into close contact with, as defined by more than 15 minutes or less than 6 feet apart, and really making sure people are doing okay health-wise, mental health-wise, and providing support with that connection to resource as needed. In terms of reporting to universities, and as folks shared, we are from Albany, so the state of New York. The New York Department of Health is required to report positive cases to universities, but not the specific contact information from the students. So the information of the number of cases is shared anonymously with schools. So they do not know the identity of the students that may have COVID-19 or may be exposed. Students can absolutely report those cases on their own, either to the university or Department of Health or both. But that is the way that the information gets shared with universities, specifically in New York State. So our next section, COVID-19 and college students, what contact tracers need to know. So in terms of who the traditional college student is, that has shifted quite a bit over the years. And generally we see college students are ages 17 to 25. Majority tend to be female identified. And our students are increasingly diverse. Dolores and I work with college students in a variety of different ways, and we see greater diversity in terms of race, ethnicity, sexual orientation. More students are coming in first generation, more likely to have a disability, and the needs and supports are different than they have been over the past several years. So that's kind of the who that we're speaking about today. As we were first preparing this presentation back earlier in the fall, as we were preparing to come back for the fall semester, the portrayal in the media was really interesting to us. You see a couple of the headlines that we pulled from August, and there was quite a bit of chatter related to what is it going to be like as students return to campus in the context of the COVID-19 pandemic after being sent home in March or so. And in terms of that, there was worry about parties and possible transmission of the virus, which we'll speak a little bit about, at students returning to living in close quarters and in the residence halls and off campus. And initially, early on, we saw quite a number of parties that were shared on social media and getting a lot of attention of students that were not necessarily following public safety guidelines. So there was a lot of worry about how will colleges manage that and what will the impact be on the communities that the colleges and universities are located in. In general, we are seeing increased mental health concerns as well in our students. Depression, higher psychological distress, anxiety, things that are interfering with their academics, again, pre-COVID, as well as those concerns that have been exacerbated as a result of the COVID-19 pandemic. So in a couple recent surveys done on students during the pandemic, we're seeing worsened mental health outcomes, increased financial stressors, difficulty maintaining a routine. Students are often in their rooms or in their residence halls for the majority of the day, logging into classes, logging into meetings, and having a hard time maintaining that routine on their own. Difficulty accessing healthcare and mental health care. And in addition to these higher rates of psychological distress, we're also seeing higher rates of resilience. And so these are national data from an Active Minds survey that was done and a Healthy Minds ACHA COVID survey that were done, both in the spring of last year. More recently, this graph is pulled from a Kaiser study that was done in December. We're seeing that as compared to other age groups, our college population, so those young adults aged 18 to 24, are having higher rates of anxiety and depression during the pandemic as compared to adults and older adults. So you see there the rates of anxiety and depression, and that was happening for young adults more than half the days or nearly every day that students were reporting that, or young adults were reporting those higher rates of distress. When we think about our college students and where they're at in their development, and even back to that earlier slide that I showed about the worry about bringing students back to campus, we absolutely need to be thinking about brain development and the stage of emerging adulthood. As psychologists, we work with students in a lot of different ways, as I mentioned, and we see those really strong feelings of invincibility. This won't happen to me, and really priorities related to social, academic, and less concerned about the safety in some cases. And so we know the brain reaches maturity around age 25. That's when we see the improved cognitive processing, executive functioning skills. And during this college time, we're thinking about, again, traditional age would be the 17 to 24-year-olds. During this time, we see risk-taking behavior related to alcohol use, drug use, experimentation, in general, risky behavior. And so there are some valid concerns related to our college students, and figuring out how to support them as they are wanting to navigate and explore new experiences. On college campuses, and in terms of COVID-19, absolutely, and in general, a number of vulnerable campus populations that we want to make sure to highlight who to be thinking about and ways to support them during the pandemic. Our Asian American students, particularly with a lot of the rhetoric related to the COVID-19 pandemic, students who are needing a lot of support pretty early on. Our BIPOC students were in this kind of dual pandemic of racism and COVID. Our LGBTQ students, many returned home in March to homes that maybe were less affirming or accepting of their identities, and really led to some new stressors in terms of being removed from their support system, and also living in an environment that was maybe a little bit more stressful. Our students with disabilities, first generation students removed from services that are typically really supportive on campus, having to really adjust to remote learning without those same supports. Our international students, many of whom were not able to return home and were quarantining in their residence halls, oftentimes alone. Our student athletes who had seasons canceled or changed, and a lot of loss there, absolutely. And then our fraternity and sorority members, who, again, we will speak a little bit more about in the context of alcohol use and risk for transmission of COVID-19. In terms of the attitudes towards COVID-19, so we see, again, with this rhetoric in the media that students, they don't care, they're going to not really be following precautions, and that's not really what we're seeing, which is good news. We're seeing that students may believe they're less likely to contract COVID-19, and if they do contract the virus, they will not become as sick. And so that perceived severity is absolutely there. But most students, from what we've seen in some of our research and even with the national norms, students are concerned about following the safety guidelines and overall do want to follow the rules. Of course, there are outliers, but in general, students are pretty concerned about that. Students are also reporting their peers who are not following public health guidelines. We'll speak a little bit more about the way it's been done at University of Albany, but students are using an anonymous reporting form to let folks on campus know when others are not following the public health safety guidelines. And we've collected data in June and again this fall and currently that supports that students are very much feeling like everyone should be following the public health safety guidelines, and also that they are adhering to those recommended behaviors, which is great news. Okay, so I'm going to share a video. I know we're getting to about a year ago from when folks were first sent home, specifically our college students. And so this video really highlights basically the feelings of our students who were struggling with a lot of loss and challenges as they first transitioned to learning remotely. So I'm gonna make sure my sound is shared as well.
This is not how I thought I would end college. My school, where I'm from, has really been impacted by the virus.
We expected something to happen soon, but we didn't know it would be this drastic so quickly.
When my chancellor
or sent out an email telling us that UCSB is going remote. I was shocked.
Students who were off campus during spring break were essentially told to not come back to campus, and they were ordered to either stay or go back to their permanent address.
Last week was my last time in the facilities. School is closed. Students were instructed to evacuate and join their families, but I cannot because I'm an international student and I cannot leave because of travel bans.
As an international student, I do not have a place to stay here, and currently I'm in a pretty sticky situation. My visa was rejected this week, so I literally do not have a place to go back right now. And my only choice is to stay here in America and hopefully Georgetown.
I have chosen to stay in Santa Cruz. This is mainly because if I am exposed to the virus and I'm asymptomatic right now, I don't want to go back to my parents' house and accidentally expose my family.
When I came home yesterday, I had a lot of paranoia around. I really just sat through a flight. I really just went through 2 of the biggest airports, and who knows what I touched. And I had this fear that, okay, if I come home, am I going to give anything to my parents? Am I going to give anything to my older relatives, like my grandparents? Being here in LA County where the cases are soaring and doubling and tripling with each day is really heightening my fear.
I may not be able to see my parents for an extended period of time. Due to their age, they are in one of the at-risk categories, and I'm very afraid that the next time I look at my phone, someone I know and love will be gone.
Few of us are left here, but everyone I know and care about is halfway across the globe. So it is definitely very hard to go through this on your own. Housing is not a problem because I already live off campus, but I believe it is a great challenge to see all of my roommates and classmates leave and join their families while I cannot do that. It is very, very hard to be productive and work online when you're very worried for your family who's in a very serious outbreak.
The whole university is now pass-fail mandatory. You can't even opt in to take a letter grade because for people who are going home to family situations that they have to take care of a loved one who's sick with this illness or, provide for their family because someone might have lost a job, they can't worry about their grades right now.
No one knows what's happening, but in terms of the professors in the universities, they're doing the best they can. They don't know how to cope just as much as we don't know how to cope.
It is, really difficult to cater to all of the needs of students online, and I think a lot of classes will struggle. We really rely on the student to professor contact and relationship, and I just don't think that's really possible online.
Having our classes being moved to online has definitely lessened the quality of our education. Like my science classes, all of our labs have been just canceled.
What really stood out to me is just how radically unprepared the education system was for this switch. I know some professors in the humanities who didn't even use email before all of this went down.
There are a lot of students out there that are really feeling lost right now and really need a friend. And they need someone to talk to because everything they knew was ripped away from them in a set of emails.
A lot of extracurriculars on campus have also been totally eliminated. I personally do research in a lab and I am not allowed to go on campus currently unless I have things that I need to keep alive.
I'm an athlete on the track team. Our entire spring season got canceled, which is really tough.
The organization that I'm the president of, all of our competitions were canceled, which I understand why. For the safety of everyone, I agree with that they were canceled. I cried a lot when I found out that all of the work we had put in for months and months and months wasn't going to happen this year.
I am in my final semester of college. I was supposed to be abroad, had that taken away from me. I'm supposed to be graduating, walking in May, and there's a chance my commencement ceremony could get canceled.
Today, actually, we just got an email that our commencement ceremonies have been canceled. It feels surreal. I'm not even sad, or I know I should be sad and disappointed, and I guess I am to an extent, but it doesn't feel real.
Having to pick up, leave everything has been it's been a lot for me to process.
Not getting to say goodbye to friends in person has led to a lot of really emotional FaceTime calls and texting calls, just thanking them for being a friend for 4 years. And I should have said stuff before coronavirus happened, and I'm learning that.
I go through periods where I feel very angry about the situation. And I also go through periods where like I'm just in shock. Like I can't believe this has happened.
So a high moment of this experience is, you know, just a sense of community and love and support.
Going on Facebook, different pages have been really uplifting with other students and graduates being in the same position. And it's making me feel a lot better.
Just a nice dose of humor and a place for all the students that are more or less my age to come together in solidarity and just laugh about things and provide support if things are more serious.
Like, we're all in this together, and the class of 2020 will be remembered for sure with all of this, and we will be celebrated one day or another, even if it's months after this pandemic.
It's terrible. I may not get to have a graduation ceremony. I may not get to see some of my friends again, but in the end, it hopefully will be because lives were saved.
This is not how I thought
Okay. So a lot of those stressors are ones that we've absolutely heard from students, and really interesting even for me personally to hear that now again after coming up on the 1-year anniversary of it. A lot of loss with our students, their relationships, what they expected for college. Interesting to hear all the uncertainty of what's going to be happening in the next few months and how it will impact them kind of long term. They highlighted a number of the stressors that we are seeing our college students are facing and are very much have been dealing with for the last year or so. The remote learning, all of the challenges related to learning and connecting with professors and peers, the difficulty connecting to resources, financial health, technology, housing, for students that home may not be a safe or affirming space. In general, the lack of social support and connection and how that has impacted different groups in particular, the loss of seasons being canceled, and the ways that students have had to really adapt to have their organizations and extracurriculars modified or go fully virtual over the past year or so, and all the loss around remote graduation. We know it's looked pretty different than the typical or expected college experience for a lot of our students, and that's been a challenge for them to continue to navigate. And I'm going to turn it over to Dr. Cimini to speak a little bit more about the alcohol and other drug use and COVID-19, first in the media and then on our campus with some data.
Thank you, Meredith. And I'm delighted to speak with you for a few minutes about the impact of COVID-19 on alcohol and other drug use and vice versa. So beginning in the summer, we started to see some articles on the national scale about COVID-19 transmission being associated with parties and gatherings that students were having on college campuses around the US. And here you see some links that you can check out later to some stories to that effect. One of the stories actually happened on a street near our campus regarding a 4th of July party. Prior to this flurry of national stories around alcohol use related COVID-19 transmission, we were actually quite curious as soon as back in April of 2020 about whether being in the pandemic increased alcohol use among our students, decreased alcohol use, or led to alcohol use being the same. And so we collect routine data on our students' alcohol use, drug use, mental health concerns, and the like. We collect data each February. But because of the pandemic, we elected to collect data as well at the end of May and through early June. And because of the data that we collected and the way we collected our data, we were actually able to look at the findings and link level of reported alcohol use to the students following or not following COVID-19 public health guidelines. Next slide, please, Meredith. So what we found is that students followed or did not follow public health guidelines associated with their level of alcohol use. And I'm sure going to show you some of the data in a minute. In addition to that, those students that reported greater levels of alcohol use actually had attitudes indicating that they felt that they needed to, they did not need to follow public health guidelines. They really didn't feel they had as much responsibility to protect the public. So it seems like we were dealing with several different populations. Next slide, please. So here you see an example. We list here student attitudes toward following public health guidelines. So what you see here is that the students engaging in no alcohol use or low levels of alcohol use were following public health or were holding attitudes in support of public health guidelines to more of a degree than those that were drinking more. And you see the public health guidelines that we were asking about at the bottom of the slide here. They're the typical ones that we're familiar with. The next slide actually shows students actually following public health guidelines associated with different levels of alcohol use. So those that were abstaining from alcohol use, and as opposed to those who were engaging in heavy episodic drinking, and that's 5 or more drinks per sitting for males, 4 or more drinks per females within the prior 2-week period. The heavy episodic drinkers were significantly less likely to be following public health guidelines, and you see what they are here. It was really very, very striking. So why is this a concern? The reason that it's a concern is that not only are we dealing at this point during the pandemic with heavy alcohol use among some students, but also we have an issue of COVID-19 transmission, because if students aren't wearing masks, they're not washing their hands, they're not being careful around the number of people that they gather around or keeping to their social bubbles, they're going to be transmitted COVID-19. Next slide actually shows you some other examples of similar patterns. So what we did at our university is that beginning in the summer, once I showed our Vice President for Student Affairs this data, we formed a group that was part of our incident management team on campus that kept looking specifically at the relationship between alcohol and other drug use and COVID-19 transmission. We engaged in intensive education with our students. We distributed masks, particularly to our students in the community where the highest level of alcohol use was going on. We also distributed masks and hand sanitizer to our community neighbors to protect them. So we did a variety of different things. But again, the take-home message is that when we're looking at alcohol and substance use on college campuses during the pandemic, we are also needing to be attentive to potential COVID-19 transmission. I expect that when we are post-pandemic, we're probably going to be seeing a rebound of alcohol use and drug use among students on college campuses nationally when they experience the freedom again to engage with each other, to gather in larger numbers and the like, and we're getting prepared for that. So I'm going to now pass it to the next slide, which is Meredith. And Meredith, if you want to speak a tad louder, you were a little soft after showing the video in terms of volume.
Okay, thank you. So this next slide highlights the COVID-19 specific challenges for colleges and universities as folks have been trying to figure out how to support students in following public health guidelines and really navigate testing and safety measures on campus. Blaming students is something we saw a lot early on and wanting to take more of a punitive approach. And that was not working for students very well. Also bringing students back to campus without adequate testing or safety measures, or requiring them to pay for frequent COVID tests. It's not taking really into consideration how to best support students. Students reporting just a lack of safe and socially distanced activities. In some of the research we've done, we've seen quite a bit of Zoom fatigue and feeling like that's not the best place for them to connect socially, but at the same time, students feeling really isolated and really some challenges reaching the small percentage of students who are not following public health guidelines. So as Dolores mentioned, students that engage in binge drinking are one of those groups. In general, we're seeing students do want to follow the guidelines. And so I'm going to share a little bit about some of the ways we've been communicating with college students through the COVID-19 AOD work group that Dolores mentioned, and some tips for communicating with students in general. In thinking about contact tracing with students, what to expect in terms of communication was a question we got quite a bit. Students are less likely to answer calls from unknown numbers. So if possible, communicating with them via an email first or a text to let them know to expect a call. We know that is not always possible with the technology, but would probably make students more likely to answer a call. Students were hesitant to provide their real names to contact tracers. So concerns that by telling the college or university that their identity would be shared, they would get in trouble, they might have to leave campus, worried about getting friends in trouble if they did violate university policy and then needed to report that they did contract COVID-19, worries about how that could impact themselves or their peers. And even just around some of the logistics with contact tracing, providing an address. So that is part of it, asking the local address when that contact tracing interview happens, and students might not think to provide their current or their local address. They might provide their family, parent, guardian, or home address. And so confirming with students where they're living and if that's going to change as a result of COVID is certainly important. In terms of our college student population, identifying high-risk students, high-risk situations with our students is important. And thinking about all the potential challenges on a college campus. So the dense contact environments could be group gatherings, game nights, spaces in the residence halls, protests, parties. And really, we've heard stories from other universities where even a small game night turned into a super spreader event on campus. So being mindful and educating students around that. It can be really challenging to isolate or quarantine for students, being out of state from family, maybe a lack of spaces on campus, having multiple roommates. Spoken with students who are quarantining in their bedroom or just one room in the house from their roommates, and that can be pretty challenging. Students that are in isolation or quarantine and complaints about the food and challenges with that as well. It can also be challenging to contact trace or identify exposures for folks in this kind of dense environment. Students might have poor recall of their contacts, could be impacted by alcohol use or the worry about potential punitive action that universities might take. And so thinking about how to respond to college students. So first and foremost, we recommend responding with empathy and non-judgmentally. As we've seen kind of throughout, and we've reiterated and students in the video have shared, students were really excited about many college experiences and have experienced a lot of loss. So really holding on to that and trying to validate those concerns as much as possible, while also encouraging them to really continue to stay safe and make healthy decisions. Validating those concerns about it's harder to pay attention in remote learning, it's maybe less preferred, a loss related to senior year and specific activities or experiences that they were hoping for, like study abroad or commencement. Asking open-ended questions, making sure to provide medically accurate information. There's a lot of myths out there about COVID-19 in general, and now with the vaccine as well, and giving them resources so that they can make decisions that are healthy and good for them. And also encouraging them to reach out for support as needed. Many students don't know about all of the resources that are available on campus. And so that's where kind of folks on campus, professionals and contact tracers alike can make good recommendations and let students know about what might be available to them. Here are some of the communications that we started creating pretty early on. So As Dolores mentioned, these came out of the task group that we are both working on. As students were coming back to campus, we used language of the social bubble or the pod that has definitely been out there and used in other contexts, but really helping students think about how do you want to have these conversations with your peers, your roommates, your friends. Why should you do that? How to even speak about, because a lot of the communication and boundary setting was new for students, and we wanted to give them some language to be able to use. So we've created flyers pretty much since August, which we've been disseminating on a regular basis and updating them for different seasons and holidays around events that we are concerned might be students might be more likely to gather and potentially spread the virus. Here's another example of some language that we've used. Again, ways to avoid bursting your bubble. There's a lot of conversation at our university around Halloween. And you can see here we've got recommendations for off-campus versus on-campus. And these were developed in collaboration with our partners that work off-campus and those in the res life world, and really thinking about how to tailor our recommendations to match what we know to be effective prevention-wise with the policies at our university. And so Dolores and others were part of email communications with students that were sent out. In addition, with these flyers, we disseminated them around campus with different organizations as well. This particular handout addresses some of the concerns related to alcohol and other drug use and COVID-19 transmission. So general AOD healthy strategies, which we've added in COVID-19 specific ones as well. And this is another example of one that was edited to be more of a winter theme, which we did again each season. And as I kind of mentioned earlier, students struggled with finding the language in a lot of ways. And so we created this to really pull from the consent and sexual health literature and sex ed to really have a conversation. When were you last tested? What were your results? What precautions are you taking? And really giving students cues of what to say and what not to say. Because for many of them, we heard just discomfort, setting a limit with peers, really explaining why it was important to them, and having to consider how does that consent either get revoked or changed if the situation changed. So if you consent to an outdoor event and then everyone goes inside and masks are taken off, are you still okay with that? Or do you want to reassert boundaries or revoke your consent? So this is another example of something that we shared most recently in preparation for St. Patrick's Day. And again, we've been sharing this particular language for several months, but updated for each kind of holiday season. And finally, this is an example of a campus-wide communication that was sent out. And this is another way that we've kind of repurposed or modified an existing intervention that we know works well, which is bystander intervention. And so Dolores modified the Step Up campaign, which really highlights ways for students to respond to COVID-19, again, pulled from more of the sexual assault, sexual health literature. So encouraging students to notice what was around them, identify circumstances, decide to respond, know their options about how to respond, and really validating they do have a choice in this, and they are encouraged to make the best decision that works for them, and really kind of encouraging them to support the community. And really it's our responsibility to keep the community healthy. On the flip side of that, we also gave them resources of things to reach out and call. As I mentioned before, there was the opportunity for students to file an anonymous COVID-19 report if they were feeling like they were seeing parties or situations or folks on campus that were not following the guidelines, and also numbers of who to call both on and off campus. And so this was a way that we, again, wanted to empower students to know how to respond in some of these more ambiguous situations. This is something that we have done in a couple of different areas, but also trained some student employees on how to really use this framework to intervene and really encourage following the guidelines. Okay, and so I know the final area that we wanted to touch on was the role of isolation with mental health. So in general, you know in the literature that social isolation and loneliness is associated with worse health and mental health outcomes. And there's been some emerging research. Again, we're in the early stages and there's been quite a bit of a flurry in recent months with a lot of new research coming out related to the pandemic, but we're seeing high rates of depression and anxiety among children and adolescents, both during and after isolation due to COVID-19 pandemic. And some more recent research has found that there are higher rates of distress associated with being a woman, having worse health, knowing someone who was previously infected, and related to lower socioeconomic status. And so really paying attention to who might be impacted during this time when folks are reporting in general that they're feeling more isolated, lonely, and not having a lot of those more informal contacts. And a lot of the ways that folks related previously are not available. In thinking about the impact of isolation, we wanted to just make sure to highlight the distinction between quarantine and isolation and the ways that we've conceptualized it in general in this COVID-19 time and when our university and how to support students. So quarantine is more about restricting the movement of folks who may have been exposed to COVID-19 until they can determine if they are infected, versus isolation is really that separating of the person known to be infected to stop spread. And so what does this mean for our students? So if our students are receive the call that they have been exposed, if they must remain in isolation for at least 10 days if they're not having symptoms, and either way be approved to leave isolation by the Department of Health. So that's where that notification date comes in. Students who are quarantining or may have just been exposed but do not have symptoms have to stay in quarantine for those 10 days, but also monitor their symptoms for approximately 14 days. It's a really stressful experience for students, and we've heard that quite a bit. So for our students that are living on campus, it's often a very quick turnaround that they have to move out of their current room and move to specific quarantine isolation housing. For folks off campus, very challenging to figure out, often away from the support system, changes in schedule, diet, issues with the food that's being sent to specific or ISO-core housing, a lack of access to the typical coping skills that work for them, such as working out or maybe social support. Often our students in quarantine or isolation are spending more time on screens and reporting more distress related to that. The worry about coping with health and symptoms. So am I getting worse? What's happening? Not having, again, those supports to help really understand what's happening for them. And I've heard a lot of guilt related to worry about exposing others, thinking about our students who are maybe less concerned for their own health, but worry about folks in the community, professors, family that they may have exposed to COVID-19. And also the violation piece. So in our university, for folks that are violating those isolation or quarantine orders, that could lead to potential conduct charges. So that's also very stressful for students about what's going to happen next. In terms of recognizing signs of distress, there's a number listed here. In general, difficulty concentrating, increased fear, worry, changes in sleep, anything that's different in terms of their habits with eating, and really the increased difficulty coping. So more crying, loss of interest in activities that you typically enjoyed, and just those feelings of helplessness could be a good time to refer someone for support or encourage students to really be mindful of when they should seek out support. In terms of the mental health resources for students, many college students might not be aware of what is available to them. Most universities do have mental health support on campus for students. Typically it's free, and many students and universities might have access to on-call or crisis hotlines, either through their university or contracted outside. Most have, again, student health services available that has been providing a variety of different services during this time, such as testing and support. And in relation to kind of where folks are at in Ohio, I know there's the disaster distress helpline that I've included here, the Ohio Crisis Text Line, and Ohio DMH and Addiction Services. So those could all be really helpful referrals for college students during this time. Many colleges and universities are providing spaces for students to quarantine or isolate on campus as needed, even for folks that are living off campus for some universities. And I've also included here just a link for college students to be able to care for themselves. So that could be helpful, just more of a simple resource to share with students who are in that kind of isolation or quarantine period that might need a reminder of what healthy activities to engage in. Okay, and we are really excited to shift to answer any questions that anyone has.
I just want to say thank you for adding that extra slide at the end there for informational purposes. Thank you.
Mm-hmm.
I don't know that this is a question, but just more of a comment as I was listening along. The topic of focusing on language I thought was really interesting, and I don't know that that in Ohio that it's been a focus or not. I don't have that information, but I liked how you took kind of the healthy relationship information and transpired that to COVID-related topics, because I know as an adult, even it's and I have probably more words to use than, you know, a young adult, but I know having those conversations with my family and with my friends is stressful. So I think that was a great way to provide the young adults with that tool as a, you know, even just as like, oh, let me read this and, you know, spew it back out. I thought that was really interesting how you use that tool.
Thank you. Yeah, we were finding that students really didn't have the language, and it's uncomfortable, as you mentioned, for all of us to be figuring out, okay, this is a new situation. How do I set this boundary? What are my boundaries? What's comfortable? What's not? What to do when things change. So that has certainly been helpful for our students in navigating this as things are changing pretty rapidly.
We've also, by the way, in addition to borrowing tools regarding our messaging, we also looked back at the science around the prevention of HIV/AIDS, which actually Dr. Anthony Fauci was engaged in back in the 80s. That was the first pandemic that he was working with. So not only was there a risk of transmitting disease, but there were also some science, some best practices around guidelines around safer sex and the like that were being shared with young people. So you know, back in the day, for the first time, what was happening to prevent spread is that condoms as well as education were given out to reduce risk around HIV/AIDS. And what are we doing now with COVID-19 when we see risk behaviors occurring like alcohol use and the like? We're giving out, what are we doing? Giving out masks, giving out hand sanitizer, engaging in education. So the best practices that we learned about back in the 80s around HIV/AIDS and prevention of transmission and spread, we're applying now to COVID-19. So it's really fascinating how science progresses and how we can go back to science in allied fields such as health education, AIDS prevention, sexual health, to address some of the challenges we're facing now with college students.
If anyone has any questions or comments, please don't be shy. I'm wondering what kind of things you have noticed as students came out of quarantining, whether it was in the individual itself, him or herself that was quarantined, or reactions by their peers after emerging from being quarantined. Any notable I guess, impacts to relationships or peer feedback, anything like that.
Meredith, do you want to take that, or do you want me to?
Feel free to take it and I'll chime in.
Okay, sure. So as time is going by, as the months are going by, I think college students in general, at least on our campus, are getting tired of being in the pandemic. They're getting tired of being put in isolation and being put in quarantine. And so we're seeing a lot of expressions of loneliness, sadness, depression, anxiety. Students really want contact with people who are supporting them. We actually created a hotline and have trained staff members in dealing with the anger that our students are, excuse me, expressing. In addition to that, what we're seeing is at times students are kind of escaping quarantine and isolation. So, they may tell us, well, we're going to go home down to New York City or whatever, to our home area. And in fact, they're going back to their residence hall rooms. So, we're just seeing more behaviors in that regard of loneliness, isolation, and attempts by some students to actually violate the parameters of quarantine and isolation. So, and that's occurring more as time is going by. Meredith, do you have anything to add?
Yeah, I guess one additional thing I'll add on, students who are finding out kind of after the fact that they may have been exposed to peers who have had COVID-19 or had an exposure are definitely very angry, and rightly so, feeling, again, like we're all in this together. You should have told me. If you're not communicating that, then almost rethinking the relationship. I've had a few conversations with students related to that, and just kind of clashing in values and maybe seeing someone in a different light. You're not willing to communicate to me this exposure. So what does that mean for our relationship moving forward? And again, just some of the worry with the isolation piece. It's challenging. And I think in that highly stressful time, we see different ways of coping that work and don't work, and various kind of supports needed in terms of mental health. So I know we've definitely tried to do pretty intentional outreach to students that are kind of actively quarantining, but I think the transition back into their day-to-day life is a great question, and how to really support students in that way as well.
It makes me think that as we are moving out of the pandemic and we move into pre-pandemic life, some normalcy, I guess, that there must be, I think of like the grieving process. Like these students have lost, not major milestones, but those rites of passage, those moments, that a young person moves through. So I'm wondering, as we are moving forward as campuses, is that something that you foresee would need to be addressed in the future? Almost like, like someone going through a grieving process because they have had losses and they're, missed out on opportunities and they're missing people in their lives.
Now, I would say absolutely. You're absolutely on target with that. Not only are we going to be expecting a rebound in terms of engagement and risk behaviors once there's more freedom that students experience, we're also going to need to work with our students to help them through the grieving process, either through counseling or educational programs or support groups on our college campuses. That would be really, really very, very important. I was in a student affairs leadership team meeting the other day, in fact, and we were talking about this very issue, that in the fall, we're not only going to need to anticipate welcoming our new first-year students, but in fact, the students who were first-year students this past September and this current year are essentially coming back to our campuses as first-year students. So we need to think about the fact that we'll have, in essence, 2 first-year classes this fall, and we need to prepare for that. Meredith, do you have anything that you want to add?
I think just echoing the importance of really validating students. I think being beyond that point, it's easy to minimize those, oh, it's just a commencement ceremony, or it's just study abroad, or the loss of a season. But thinking back to how important it is to our students and developmentally where they're at, how important the social world is for them, and how, again, there has been such a loss of what they expected college to be, and they've been having to really just kind of navigate through and continue to be paying attention with their academics and keep everything on track while mourning really the loss of that. And so I think students have had various opportunities to do so. So really making sure there is that time built in for those that are still kind of on campus.
And our students in some focus groups that we conducted listed transparency as something they value very, very much. They understand that things can fall through the cracks. They understand that all of us are dealing with the fallout of the pandemic. But what they really want from us is to show that we're human. If we're facing challenges as faculty members, as staff members at colleges and universities, as COVID-19 tracers, as whatever we're interacting with them on, to acknowledge that we're struggling too. Because sometimes, we have that facade, we feel we need to show how perfect we are and we have it all under control. But you know what? We don't always, and students understand and appreciate that fact and want to see it. They want to see us as human.
I appreciate that. I think that, like you said, as professionals, we always want to be, presenting ourselves as such, and kind of not placing ourselves even in a vulnerable place with a student, or even with a colleague. But yet we are all in this. We're experiencing this pandemic together. Mm-hmm. So I appreciate that you shared that. I'm wondering if any of the attendees on this webinar have any thoughts around things that they might be seeing when they are looking at the student body at their particular campuses, as far as emerging behaviors by students that could potentially, I think Dolores, you mentioned that as students are moving out of this pandemic, they're just tired, and they want that, one-on-one contact. They want to be a part of a peer group more consistently than on screen, and that we need to prepare for that as on campuses. We need to prepare for those kinds of behaviors, excuse me. So I'm wondering if any of the attendees here today have any thoughts on that. What are they looking at? Are they looking at it? What are they preparing for? If anyone feels more comfortable, you can put anything you want in the chat instead of speaking.
Now, I think as all of us are thinking about moving forward, one of the things that also comes into the mix is the level of social unrest that has occurred around the tragedies, the George Floyd tragedy and other tragedies that we have experienced as a nation the last few months. Concerns that are groups who have been historically marginalized are facing on top of the COVID-19 pandemic. It seems that COVID-19 is really an overlay that has magnified the challenges, the social justice related challenges that our students are facing. And it's hard for them sometimes, we find, to differentiate what is contributing to their feelings, their reactions, their loneliness, their isolation. Sometimes the students feel that nobody cares. Nobody cares. There's just violence all over the place. I'm vulnerable. I don't matter. Just a lot of reactions going on on the part of students and staff and faculty too.
Yeah, I almost feel like the pandemic has magnified some of the marginalized communities as far as even access to healthcare, access to anything surrounding COVID-19 related things. And like you said, on top of that, we have huge social injustices happening.
Mm-hmm.
And that not even just in the United States, but in the world.
Yes. Yeah, so Meredith and I were presenting this morning at a meeting of our LGBTQ plus advisory council on campus. Meredith did some analyses in terms of the effect of the pandemic on our students who are identifying as LGBTQ plus. And one of the things that we were reminded about is that the narrative that we share is very important around this, because those injustices, those reactions that our students experience, that what they experience has been going on for a long time, and the pandemic has just magnified it. So it's not like when the pandemic lifts, this is all going to get better or go away. In fact, it probably will continue. And what we're also finding is that students are really speaking up. They're protesting. They're calling out injustices they see. So it's actually activated students in a very positive, resilient way on our campus and our experience. Meredith, I don't know if you have any thoughts that you want to share on this piece.
Yeah, I appreciate the connection to the earlier presentation. I think with all of everything we've presented and shared today, being really mindful of in those intersecting identities and our students that are historically marginalized, and the kind of compounding effect of all these stressors. And in this morning's talk, we were thinking about, okay, yes, COVID-19 and that specific worry and anxiety related to that, but also the divisive political climate and discrimination and all the different ways that all these things are impacting students as they continue to engage in their academics. And so being really mindful of that, and also doing really targeted prevention and outreach work with them.
So I'm wondering, in one of the first slides that you presented, you showed the statistics on the stress impact and how young adults are greatly impacted by the stressors of this experience. What is the difference, do you think, or maybe there's data behind that as well? What is the difference? Why is this particular age group being so extremely impacted compared to the other age groups?
Yeah, it's a great question. There wasn't a lot more detail about the why in that data set, which I think is interesting. But I think we can definitely make some guesses with that. And when we think about the traditional college student age and the young adult age, we've mentioned this before, but kind of the importance of social connections. And it's this period of students that are kind of finding themselves, navigating identity, figuring out who they are. And then when we think back to that video for students speaking about it, was kind of ripped away, and really rapidly having to kind of end relationships, be away from family, be away from those stressors, where as many of us didn't move in the same way that students did, didn't uproot, didn't change the whole plan. Many of us are working remotely, but that was often the biggest adjustment, where students had a number of different changes. I think our students are increasingly, our college students specifically, are increasingly diverse and really presenting with identities that are requiring more support. And again, these students were here before, but as you mentioned, the pandemic is really kind of exacerbating these stressors, and they are speaking out in ways that I think are more vocal than other age groups too about these injustices. Dolores, I don't know if you have things to add related to that.
Yes, and also the age range of traditional college students, that is ages 17 to 25, are also often the first years if there is a mental health concern or psychiatric diagnosis. It's the first time that it appears, whether, you know, it might be the first depressive episode or episode of bipolar affective disorder, schizophrenia. A lot of things occur during this time period for young people. And for younger children, depending on where they are developmentally, they may perceive what's going on in the pandemic in different ways. They may think it's all good because they're with their parents all the time, go to school at home, you know, that kind of thing, and see their friends on Zoom. They may not be as affected in the same way because they do have generally the protection of their parents and their parents helping them frame that. But with college students, where they're at a time when they're experiencing freedom for the first time, as Meredith said, it's a very, very different type of experience.
Thank you. I appreciate you answering that question, and the mental health piece does make sense. And I think, you know, in my personal experience, I have a son who's 19. He's about to finish his spring semester with an associate's degree, and he has good support systems. But then I've heard stories from him of others that he's either roomed with or gone to school with, who left during this pandemic and just didn't come back, or they, you know, had to wait a semester to grapple with figuring things out, you know, kind of. So, you know, I think about his stories to me, and, you know, those are his friends too. He's impacted by them not being in school and adjusting to his kind of their new friendship. So while he can kind of buzz back in and out of the beehive because he has that support, there are others, his friends, who have not had that support. And, you know, sometimes I hear the inflection in his voice, like, I don't know what's happening with my friend now because he's not at school. I don't have as much contact with him. And even though I've tried to reach out, he doesn't always respond. Mm-hmm. So I know that there's concern there too.
Yes, and understandably so. It's really, really challenging. I think the pandemic is really going to change the face of higher education. You know, in some ways for the better, because we've learned a lot of things around working outside of the box to provide education to our students, and actually in some ways providing more access to education for some of our students. Then on the other hand, it actually may help to minoritize those students that are traditionally marginalized, because they may feel more pressure to stay home and work to help their families, take care of ill relatives, that kind of thing. So, you know, I think it's really a question to some extent what higher education is going to look like in 1 year, 2 years, 5 years post-pandemic.
Yes, I definitely agree with that statement. And I think that if campuses, universities, and colleges aren't thinking about it now, they will be thinking about it very soon as the new, the fall semester starts to pick up and their student body starts to look different.
Mhm. Well, it certainly is a challenge, but where there are challenges, there are also hidden opportunities, and it's important for all of us to try and look for the open doors and the opportunities, I think, in our challenging times.
Yes, very much so. Well, we're going to wrap up, and I really thank you both for your time and your expertise and this very informational presentation. I really appreciate it. And if anyone should have any questions of OCI, Ohio College Initiative, please feel free to reach out, visit our webpage. We have lots of resources on there. The webinars, this one included, will be recorded and placed on the webpage so that it can be viewed later by anyone. And yeah, we encourage people to just keep moving forward.